Hi there. Good morning. We're going to let a couple of seconds here go by, so we're allowing people to join in. So it's Wellness Wednesday again. Thanks for joining us. And again, we are with Dr. Even. She is our Chief Behavioral Health Officer and Clinical Psychologist. And today, Dr. Even and I will be talking about sexual assault. And just a quick reminder here at the beginning that if you are a victim of sexual assault, please call 911. If you haven't called 911, then give us a call here and we can put you in touch with the right advocate to help you out with that situation. And today, Dr. Even is going to talk, about sexual assault. The impact of sexual violence extends beyond the individual survivor and reaches all of society. Sorry, just can't talk today, obviously. An assault may impact a survivor's daily life, no matter when it happened. Each survivor reacts to sexual violence in their own way. Common emotional reactions include guilt, shame, fear, numbness, shock, and the feeling of isolation. So, Dr. Even, good morning. I have some questions here for you. What are some steps that you can take after a sexual assault?
So it's hard to know exactly what to do after a sexual assault, how to feel, or even what your opinions and options are. Please know that you're not alone. Below, I'm going to talk about some things that you can do. If you are an immediate threat or an immediate harm or not safe, I want you to call 911 if you feel comfortable with that. If you're seriously injured, call the police, get some help. But your safety is the most important thing. So I want you to kind of look around and see if you feel safe. If you aren't feeling safe, you need to call somebody that you trust to come help you. Also know that what happened is not your fault. Something that you did not want to happen happened to you, and it's okay to not be okay. I want you to call the National Sexual Assault Hotline at 800-656-HOPE. They'll connect you with the trained staff in your area and be able to direct you to appropriate local health agencies, advocates in your area that can help you, and even a therapist if that's what you decide you want to do.
What are some of the psychological implications of sexual assault?
So one of the most experienced psychological impacts is going to be depression. Depression is a mood disorder that occurs when you're feeling after something happens. You might feel like isolated, you might feel sad, tearful, hopeless is a really common experience. This need to kind of withdraw from those around you, loss of pleasure, not wanting to do things you used to want to do. It affects your behavior, it affects your daily activities, and it can affect your relationship. It's important to know that depression doesn't discriminate. It can affect anyone, age, race, gender, ethnicity, or religion. And it's normal for survivors to have feelings of sadness, unhappiness, isolation, hopelessness. If these feelings persist for an extended period of time, you may want to consider reaching out for some more help. Don't expect to just snap out of it, because depression is a serious medical condition that you can get help with. Another common psychological impact of sexual assault is PTSD, or post-traumatic stress syndrome. It's technically an anxiety disorder that can result from a traumatic event. You may have heard about this with military veterans, but PTSD can occur after any trauma that you experience and has characteristic symptoms of anxiety, fear, stress, and nervousness. And this is normal with PTSD. While all survivors react differently, the three main symptoms of PTSD are going to be re-experiencing. So those flashbacks or nightmares, just remembering or having intrusive thoughts of what happened to you. Another common is going to be hypervigilance. So this is that kind of feeling on edge or kind of uncomfortable in all situations. And then also avoidance. So that need to avoid anything that might trigger what happened to you.
I know it's hard to put into words what sexual violence looks like, but in your opinion, excuse me, what does recovery from sexual violence look like?
And that is hard because there is no textbook presentation for recovery. It's different for absolutely everybody, and it's a process. It can take weeks, months, or even years for individual people. But there are some things that you can do to kind of start that process. One is safety planning. So brainstorming ways to make yourself feel safe outside of your home and avoid risk for future harm. Some people might find benefit in telling a loved one about their assault. Now, this may be hard, and it may not be for everybody, but reaching out to somebody you trust and talking to them about what happened to you can be helpful. Also, self-care is really important after a traumatic event. So taking time for yourself, doing things that make you feel good and safe can have a very lasting impact on your mental health. And also be kind of careful about what you ingest in social media. For instance, movies, posts, those types of things that have any kind of sexual assault, sexual violence, or even incest can be really triggering. So it's important to be careful about what you're consuming on the media.
When should a victim of sexual assault or violence get help?
And again, that's different for everyone. I think it kind of goes back to that. If you feel that your depression or your PTSD, if it's interfering with your daily life, if you're having difficulty getting out of bed or reaching out to your loved ones or feeling hopeless, it might be time to reach out to a professional. Again, if you call that National Sexual Abuse, Next Sexual Hotline at 1-800-656-HOPE, they can connect you with a local counselor in your area. There are therapists who are trained to do trauma work and to help you process and regain control in your life.
The stereotype that's been going around for decades is that a molester, a rapist, has a certain look to them. And, excuse me, I have found that's not to be so true. So, from your clinical background, can you tell everybody what does a sexual predator look like?
Yeah, I think you're right, Nancy. There is no look to someone who's going to perpetrate. It doesn't discriminate any race, age, appearance. It's just important to make sure you're fully aware of your surroundings and kind of have that safety plan, a way to mitigate risk, because there's no way of telling who could be a potential perpetrator.
So any women out there, again, that has been a victim of sexual assault, please call 911. Please call the National Sexual Assault Hotline. We will post that number again up on our Facebook page. And if you're going out on first dates or anything, let a friend know where you're going and who you're going with. And don't leave any drinks out in the open that somebody could spike. So I want to thank everybody for joining us and thank Dr. Even for her wisdom. And we will see you again in June for another round of Wellness Wednesday.